Okay, let's discuss today spherical ZP gas permeable lens. Here we call it corneal lens too. So let's discuss this topic. I think this topic will take 3 videos. So what is ZP fitting? So basically, it involves the construction of complex three-dimensional structure to sit without any aid of support, adhesion, or vertical inclined surface, where being repeatedly dislodged by the covering surface. Basically means, what do you think? So GP lenses, basically corneal lenses, are smaller than cornea. So it has to be attached with the cornea, yes, and there are several forces acting on it. And how do you actually manage to attach it in a proper mm, setup so that uh, it gives the proper optical benefit? Yes, if it's too much of thickness of tear layer beneath the contact lens cornea, so contact lens will pop out. So there are a lot of things, too much of interaction between lens edge and the upper lid, contact lens will definitely move a lot, and it will not stay on the exactly proper place. So what do you mean by proper place? It means at least the back optic zone diameter or front optic zone diameter covers the pupil. At least that's the least we want. Definitely, we want good coverage. We want good centration, definitely. But at the same time, that's the least we want. If it is comfortable, definitely comfortable is very important for patient. Yes. So ZP fitting stability made easier by what are the things that helps to make stability easier? First, lead. Sometimes we want lead attachment, isn't it? So upper lead especially helps to prevent lens falling from the eye. So that's what do you mean by that? Lead, upper lead attach the contact lens. That's one of the philosophy of contact lens fitting in corneal lens. That is a lead attached, upper lead attached contact lens fitting. Another fitting philosophy is interpalpable. Lead do not attach any portion of the contact lens, but at the same time, contact lens hold on interpalpable space. So one thing can be lead can attach. Another thing is change in the curvature in the limbal region or prevent side off for drifting. So basically means in the limbal region. So basically curvature change means what? It means basically axial lift we can change. Yes, and third is capillary force in pre-lens tear film. What do you mean by that? It holds the lens in a place but weak enough to avoid the adherence. It basically means the capillary force of the tear film. Yes, which basically try to hold the contact lens at place in front of the cornea, but it's very weak. So, what are the challenges on ZP fitting? So basically, obviously we know it. So no two eyes have precise same dimension. That's why two eyes we have to deal separately. Second, the worse refractive error, the less predictable sit. For example, keratoconus. For example, what do you call that? PK after that graft shift. It's very difficult. These cases are, and definitely one of the major challenges is reflex tearing during adaptation. So we cannot examine whether patient is doing well with contact lens or not, at least for adaptation period, which is in RGPs. Some patient takes 30 to 40 minutes. Yes. So rigid lens can be very uncomfortable no matter how good fit is. This is very important point. The student must know, and I think a lot of practitioner must know if they if they yet not practiced the rigid contact lens, because rigid contact lens, no matter how good you fit it, it will be difficult for patient, especially for new wearers. Yes, it's uncomfortable, and so you have to counsel your patient first. It will be uncomfortable a little bit. Yeah. So factors affecting GP fitting. What are the factors? Definitely corneal limbal anatomy, major factor, isn't it? So lead geometry and mechanism. Basically, the interaction of lead with the contact lens is very important, and it's more important in case of corneal GP lenses. It's less important in case of soft contact lens. Yes, definitely important in case of soft contact lens, but not important as in case of corneal lens, corneal GP lens. Obviously, if there is pterygium, it will be difficult. So Let's talk about corneal topography, cornea and diameter. What it does. Diameter of the cornea, especially SBID, will influence the choice of contact lens diameter. Yes, difficult to measure the true diameter due to the gradual change in transparency at the limbus, but yes, we use SBID. And SVID is approximately 1.5 smaller than the actual cornea, so it's rough. Yes, sometimes we call one SVID minus 2 in case of RGP, and at the same time, soft contact lens SVID plus 2 for a rough guide. But yes, it's basically depend upon manufacturer to manufacturer, and we have to see manufacturer guideline. We have to follow manufacturer guideline, isn't it? So corneal topography, so cornea curvature. Definitely cornea is prolate, which is center is steeper as you move from center to periphery. It's flatter. Yes. Um, yes, it's very important. You must remember spherical RGP. Spherical RGP is very difficult with against the rule astigmatism, and it's easier with the rule astigmatism. It's very important to know. Okay. So this is the condition in which it's with the rule, basically dumbbell attached in this 180 degree. It's against the rule. The dumbbell, what is called black dumbbell size uh, structure is in 90 degree. So that's it's against the rule astigmatism. It's with the rule astigmatism. Yes. So in against the rule astigmatism is difficult. So why it's difficult? Because it's sideways decentration is common with against the rule astigmatism, and we will definitely talk why sideways decentration, why against the rule astigmatism is difficult. But for this now, it's always better to remember high against the rule astigmatism is difficult with spherical corneal lenses. Lid, both upper and lower lid can help to position the lens high enough to cover the pupil, definitely. The lens effectively pass from one lead to another lead between blink. This is always happen, yes. So palpebral aperture height is measured prior to fitting. It's we have discussed about it, yes, in preliminary examination. Why palpebral fissure height is important? Because smaller the palpebral fissure height, smaller the diameter of the contact lens should be chosen, and larger the palpebral fissure height, larger the diameter of the lens. That's very directly proportional a relationship. So the relationship between leads and the limbus should also be considered, because it's not about just palpebral fissure height. It's about where that lead of the uh, sorry margin of that lead exactly lies. If it is like exactly in the lower limbus or not, lower lead. If upper lead is exactly around 2 mm, then upper limbus or not 2 mm below. So that's very important. Yes. So when upper lead is high, so downward decentration. So that's very important. What we expect if this is cornea, upper lid is approximately here, yes, around 2 mm. Upper lid margin is around 2 mm below. So that's upper lid. If it's higher, when upper lid is high, then what happens? We expect downward decentration because we know upper lid will hold the contact lens, yes, maximum times, and that's why we have to choose larger diameter lens. So encourage the upper lid to grip the lens and hold in the place. So that's called lead attachment philosophy. Basically upper lid attaches the hold the lens. Yes, when upper lid is low, what happens? Then upward decentration is chances. So when lower lid is high, of now we come to the lower lid. When lower lid is high, what do you mean by lower lid is high? If it is cornea, then lower lid must pass from the limbus. Yes, if it is high, then we have to think about a small diameter contact lens. If lower lid is low, below the lower ciliary line, then we have to think about larger diameter corneal lens. Yes. So I think today we have to discuss about this in very deep. Yeah, it's force acting on the GP, force acting on the corneal lens, gas permeable lens. So I have taken this picture from the contact lens practice by Efron. I think it's third edition. So these are the six forces, and we are slowly going to discuss about the six forces. Yes, what what are the forces? First, capillary attraction and post lens tear force. Basically, it means capillary attraction of the tear. Second, tear fluid squeeze pressure. Third, gravity. Fourth, is specific gravity of a material, definitely. And center of gravity also plays around it. And fifth, tear meniscus force or edge force, tension force. Basically, tear meniscus force. Yeah, here you can see. Yes, tear meniscus force. And you can see tear fluid squeeze pressure. Yes, and eyelid force. Definitely, eyelid can force towards outward, and eyelid could force towards inward. That contact lens, the same contact lens. Yes. Yeah, let's discuss one by one. What is capillary attraction force? It's very simple, yes. The distance between two surfaces basically means the more closely the surface matches the counter of the cornea, greater the capillary force. Basically, the distance between cornea and the posterior surface of the contact lens is bigger. Forces, capillary attraction forces are smaller. It's very simple. The more closely the lens surface matches the corneal counter, greater the force. That's why we do not make. So today we have CNC, yes, right? So we have technology. We can make the posterior surface of the contact lens exactly same as a cornea, yes. But we do not do that because if we do that, what happens? The lens surface matches the corneal counter. Then whenever it matches the corneal contour, the greater the attraction force, capillary force. And what happens? Lens stick to the cornea, and that's what we strictly don't want, because we want lens to move. We want lens to move approximately 1 to 2 mm, because whenever the lens movement, there is a tear exchange, there is a deflux of that whatever debris under the tear. Yes, new tear replaces it, so oxygen permeability goes up. So there are a lot of benefit when lens moves. But lens, we want lens to move in an optimal way, not that high, like greater than 2 mm, not less, like less than 0.5 mm. So that's why movement is important. That's why we do not want our posterior surface of the contact lens exactly matches the cornea, so that there is a high capillary attraction. Just got the point, I think. So but the lens that conforms exactly to the posterior corner wouldn't comfortably tolerate. Why it's not comfortable to? It's stick to the cornea. So we do not want to make the contact lens through CNC technology, the posterior surface of the contact lens exactly match with the anterior corneal contour. We do not want that. So it causes the minimal lens movement and tear circulation beneath the lens due to the greater capillary attraction. That's why we do not want that. We want lens to move, and we do not want the distance between two surfaces so large, definitely. So that forces, capillary forces goes so low, but we do not want at the same time the distance between two surfaces extremely small, so that capillary force attraction goes up. It's balance, yes, it's balance between two. Yeah. So capillary attraction post layer, the forces is greater with the spherical cornea compared with the astigmatic cornea, definitely. So see in this picture, in this graph, I have again taken this graph from the Efron third edition. So can you see this? So average tear layer thickness goes up, yes. Percentage of alignment also goes up. So what happens? So in apparent percentage of corneal alignment, which is PCA, and average tear layer thickness, which is TLV, and increases corneal with increases corneal astigmatism. See, in axis is corneal astigmatism increasing. So what happened here? So average tear layer thickness, if corneal astigmatism is increasing, the average tear layer thickness, what what is doing here? Goes up, yes. Average tear layer thickness is goes up, but at the same time, what goes down is apparent percentage of corneal alignment. So there is less alignment if corneal astigmatism is goes up. Yes, it goes down. So that's why what happened, though the average tear layer thickness increases with increases, but at the same time they are corneal alignment decreases. Yes. So the force is greater with the spherical cornea than astigmatic cornea, because if whenever astigmatism is goes high, at the same time the apparent percentage of corneal alignment goes down. So there is a greater force with a spherical cornea, with a spherical contact lens, definitely with spherical RGB contact lens. Second force, tear fluid is squeeze pressure. What is that? So that is the pressure that develops behind the optical zone in the posterior lens. So it's in behind the optical zone, the center of the lens by opposing gravity force and eyelid force by equilibrium. What do you mean by that? The gravity force acts to decenter the lens inferiorly. Definitely, gravity pulls downward. Eyelid force acts to decenter the lens in a superiorly, because eyelid attached the contact lens. Yes. So what happens between whenever the two forces plays? So then there is a force which is a tear fluid squeeze pressure. Whenever that squeezing of tear fluid, yes, behind the contact lens, and it's actually behind optical zone of the contact lens. So directly proportional to the tear lens thickness. So in a lens with zero optical apical tear thickness is placed on the cornea, so no tear fluid squeeze pressure is there. Yes. So lid manipulates the lens position. So if greater the thickness of the tear beneath the optical zone, greater the tear fluid squeeze pressure is there. So third is gravity. For a corneal lens, center of gravity is near the back surface or actually behind the lens. It's very important that center of gravity, because whenever we talk about center of gravity is always be there. Yes. So as the center of gravity moves behind the lens, greater the area of support about it. So basically, if center of gravity moves behind the lens, greater the area of support. As the center of gravity moved in front of the lens, what happens? Less support tend to drop more rapidly under the effect of gravity. So basically means if center of gravity moves in front of the lens, it's flat fitting. Yes, fitting is flat. Lens will move more. If center of gravity moves behind the lens, it's steep fitting. Yes. So we have to know what are the factors that plays a role to make sure that center of gravity moves behind the lens towards the eye, or center of gravity moves in front of the lens, that means away from the eye. Yes. So main important three factors are very important. The position of center of gravity, one, total diameter, what happens when total diameter increase or decrease, whatever thickness increase or decrease, whatever back optic zone radius. So basically means base curve making flatter or steeper. These are three things. So this, I have taken this graph from the book Contact Lenses by Phillips, definitely in 6th edition, 2019 edition. See, in this is for positive lens and this is for negative lens. It's a little bit different, but in both cases, total diameter plays vital role. See, whenever we change total diameter by 0.1, shift of center of gravity by 0.08 mm. That means its effect is 4.5 times in negative lens. At the plus lens, it's 7 times. Yes, it's very important. Total diameter, changing total diameter by unit will change center of gravity by a lot, like 7 times in plus, 4.5 times. Back radius in plus 2 times, in minus 1 times. So base curve change by 0.05 will change center of gravity. Definitely, we know that whenever we make it steeper, center of gravity moves towards the eye. Whenever we increase the total diameter, center of gravity moves towards the eye. That's why increasing total diameter means making it steeper fitting. Making more curved base curve means steeper fitting, isn't it? So central thickness, it's very easy, yes. When you increase the central thickness, center of gravity moves away from the eye, flatter thickness. When you decrease central thickness, it means center of gravity moves towards the eye. So see, in case of plus lens, central thickness by one time change. So it means changing central thickness by 0.01 mm, shift of gravity by 0.002 mm. At minus lens, it affects more, so 1.5 times. See, this graph is very important graph that you have a rough idea now. So what happens there? Yes. So with the change of, so if you have to choose one factor which is greater effect no matter what, it's plus or negative, it's definitely total diameter. Yes, total diameter affected center of gravity like extremely heavily in compared to base curve or central thickness. It's definitely base curve and central thickness are also important, but for center of gravity total diameter is like major factor. Yes. Yes, let's move further. As I have told you, thicker the lens, center of gravity moves away from the eye. Yes. So positive lens, center of gravity moves away from the eye. So steeper the cornea, center of gravity moves. Basically, steeper cornea means what? Steeper the base curve, center of gravity moves towards the eye. Flatter the cornea, center of gravity moves away from the eye. Yes. Smaller the total diameter, center of gravity moves away from the eye. Larger the total diameter, which is central important factor, center of gravity moves towards the eye. Whenever towards the eye, stiff fitting. Whenever away from the eye, flat fitting. Isn't it? Stiff fitting towards away from the eye, flat fitting. Isn't it? So basically, stiff fitting here, it's flat fitting here. Basically, flat fitting here is stiff fitting here. Isn't it? So just pause the video and just see all the picture and just internalize these things for yourself, by yourself. Okay, I have taken this picture again from Phillips 6th edition contact lens book. So now come to the specific gravity. So what is specific gravity? There is no major effect of contact lens fitting on change on the to material of different specific gravity. So what are the recommendations? In a high riding lenses, basically if lens riding up, the material changes provide no improvement in centration. Fabrication of the lens with a thinner designs may improve some benefit. So specific gravity, sometimes you see in the book that making contact lens lighter. What do you mean by having smaller specific gravity? Basically means contact lens is lighter as compared to other contact lenses. So whenever contact lens is getting high riding, it's better that you use thin design lens to provide some benefit. Other not extremely reliable on specific gravity, but yes, specific gravity plays role. If contact lens is low riding, basically it's dropping down. To select the low specific gravity material, yes, it will help because it will reduce the mass. But at the same time, thinning the contact lens also helps. Yes, because we have already discussed. Yes, thinner the contact lens, center of gravity moves towards the eye. So it's basically means contact lens do not drop, but thicker the contact lens will drop. Yes, because of the heaviness, and another important point because the center of gravity moves outside of the eye. So that's basic stuff. So tear meniscus force. So we have talked about a lot of tear forces, yes, also known as is tension force. So force produced by the tear meniscus under the edge of the tear lens. That's very important. Tear meniscus force means we are talking about the edge of the contact lens. So plays key role in maintaining the continuous tear film at the edge. It's very important because even tear exchange also depend on it. So acts as a hold on the lens against the cornea whenever the lead force do not cover the edge. It's very important. Whenever the lead force is not covering, it's important force. So greater the circumference of the meniscus, better the lens centration. So it's always there. Yes, but thicker the meniscus, it's difficult. So basically, higher the edge lift, so flatter the fit. So is edge lift is not edge lift, but edge. What do you call that? The distance between edge of the contact lens and the cornea. So tear meniscus force is basically means the peripheral curve is close to cornea. Tear meniscus doesn't hold the lens on the eye and reduces tear excess. Basically, as if the clearance is large, the meniscus is inverted and will reduce the adhesion. Is basically what I'm talking about this. So basically, we don't want that large clearance, do we? We don't want large clearance here. We want adequate. We don't want the smallest clear, because if clearance is very, it's like extremely tight, so there is less tear extents. We want tear extents, but at the same time, we don't want it to be very large. If it is very large, then meniscus is inverted and it will reduce the adhesion and possibly cause one of the cause of 3 or 9 o'clock staining. Or yes, you will see if clearance is too large, you will definitely see bubble under the edge. You'll definitely see if it is too large. But too large contact lens, it's very easy. It's like moves a lot. It's like extremely difficult for the patients for adaptation. There are a lot of things, because flat contact lens fitting is very easy. What is difficult is optimum, distinguish between optimum and tight fitting. Yes. So eyelid force are extremely important force for the position. So it exerts the principal role in RGB lens mechanical force, and lens may displace because blink. It's a very important. Upper lid plays major role. Yes, lens may be supported by the lower lid. So
Good.
so let's move further. I have not show this video. So eyelid force and the position. What are the eyelid force and the position? Between blinks, the eyelid force affects extrapalpebral fitting lenses by acting normally to the contact lens to hold against it the cornea. This results negative pressure which keeps the lens centered and or high riding. So counteracting the gravity which would force the lens to ride low. So basically means whenever upper eyelid forces the contact lens, it will create the negative pressure in that lens and the cornea, so that tear film between that, which basically help upper lid to hold the contact lens and to hold contact lens against the cornea. So when tear force and eyelid force so are inadequate, the gravity force excessive or the lens is too thick, then lead may push the lens. So that's why it's a play between these two things, basically eyelid force and tear of force and the gravity, and upper lid interact with the eyelid, so they actually doing opposite force to each other. One try to hold the contact lens, another will definitely push down the contact lens. So gravity force and the excessive or lens is too thick and it will interact with the lid, it will push down. So and these two factors will try to adhere the lens to the cornea. Yes. So you have to take into this account like push and pull. Yes, one thing pushes contact lens, another thing pull the contact lens. So that's it. So eyelid force and position. So this is a picture of contact lens riding high. Yes, between the blink of eyelid force affect the extrapalpebral fitting lenses by acting normally to the contact lens to hold against the cornea. This result negative pressure and which keeps the lens centered or high riding, encountering the gravity which would keep the lens riding low. So the tear lens force and eyelid force are inadequate inadequate and gravity force excessive or the lens edge is too thick, the lead may push. So the same thing. Yes, if these two forces are not good, then gravity or the interaction of lens edge with lead will definitely push the contact lens down. Yes, it's very important. So so basically that same stuff is there. So between the blinks, if this is extra palpebral fitting lens are acting normally and the contact lens against that, the result of negative pressure which keeps the lens center or high riding, that's what happened. Lenses go low riding. So this is the contact lens picture of low riding. Yes. So basically same stuff is there. Basically these two forces are inadequate. Then what happens if gravity force is excessive or lens is too thin, then it will push down. So now what we want is between the blinks, eyelid force affects the extrapalpebral fitting lens and acting normally on the contact lens and holds against the cornea. This results in negative pressure, which we know, and it keeps the lens centered. n or riding high encountering the gravity. So that's the pressure we want, which encounters the gravity. Yes, and normal fitting is there. So I think I will stop here, and I will make another video from here. I think in RGB contact lens will take 3 videos. So okay, please don't choose.